Good evening. Another day of concerning COVID case numbers as more than 1,200 people have been infected with the virus. And the province is now entering record territory when it comes to both hospitalizations and ICU cases. More than 400 people in hospital, 125 in intensive care. Also tonight, health officials have announced the current restrictions in BC will remain in place, but won't say for how long. Another development breaking late this afternoon, the NHL has delayed the Canucks' return to play indefinitely as the team recovers from isolation. And the CEO of Pfizer is suggesting a third dose of its vaccine may be needed to fend off the virus. A lot to get to tonight, but we start with new modeling that shows we could hit 2,000 cases a day in a matter of weeks if our interactions are not reduced. CTV's Binder Sajjan begins our coverage.
Dr. Bonnie Henry.
Unveiling new data, Dr. Bonnie Henry says during the third wave, the city feeling the brunt of the pandemic pain? Surrey.
That's why we're focused on fire and police services starting in Surrey.
That program, which includes school staff, will soon be expanded to North Delta, the Tri-Cities, and other regions hit hard by COVID-19.
So if I'm seeing a group of 10 people, the probability that one of them has the virus and is potential to spread it to me right now is highest than it's ever been.
New restrictions focus on reducing transmission, particularly in workplaces. And here's why. In February and March, most workplace clusters in Vancouver Coastal were linked to indoor dining or drinks, gyms, and offices. In Fraser Health, that shifts with more industrial clusters along with restaurants, bars, lounges, and fitness facilities.
We continue to see that school-aged children are less likely to be infected with COVID.
Dr. Henry also presenting results of school surveys, one from Vancouver Coastal Health late last year, the other from Fraser Health earlier this year. They show only a small portion of transmission happening in schools, but with variants on the rise.
We have not seen increased transmission related to that in schools to date. That is something we are watching. We are assuming, as I mentioned, that that any case is B117 now.
Dr. Henry says the goal is to immunize all school staff in the province in the coming weeks. At the same time, officials are watching what's happening in Surrey, home to many essential workers and multi-generational households.
Making sure that the immunization programs in Surrey are being targeted to those populations in neighborhoods that are most at risk.
The data showing if people don't pull back their interactions, within weeks, we could hit 2,000 cases per day. Binder Sajjan, CTV News, Victoria.